Ever felt a tight, heavy pain in your chest that stops you in your tracks, maybe on a hill or just walking to the shops? That could be angina. And today I'm going to explain what's happening in plain English, how to know when to worry, and what you can do to protect your heart. I'm Dr Sophie GP, and stick with me because by the end you'll know exactly what to do if it happens to you or someone you love. So what is angina? Angina is basically your heart saying, "Oi, I'm not getting enough oxygen here." It's pain that comes from the heart itself, usually when the blood supply to your heart muscle can't keep up with what your heart needs, often because the blood vessels have narrowed over time. And we're talking about millions of people living with this, so you are certainly not alone. So what does angina feel like? Well, the classic symptoms are things like tightness, pressure, or heaviness across your chest. Sometimes spreads to your arms, your jaw, your neck, even your stomach. And it usually happens when you're active, so walking up a hill, rushing for the bus, and then it eases off when you rest or you use a special spray called GTN under your tongue. It tends to last a few minutes, not hours. If it goes on for more than 10 minutes or it happens when you're just sitting, watching TV, then that's a red flag. So more on that in a sec. So why does it happen? Right, imagine your heart's arteries are like little garden hoses. And over time, fatty deposits, we call them atheroma, they build up, making that hose narrower. So when you suddenly ask your heart to pump harder, the blood just can't get through fast enough. And that is when the pain comes. Sometimes it's caused by a spasm in the artery rather than a blockage, but the end result is the same. Your heart isn't getting the fuel it needs. How do we diagnose it? The story you tell us is actually the biggest clue. And then we'll usually do some blood tests, an ECG, and that's the heart tracing, and sometimes some scans or an angiogram, which is basically an X-ray that looks at the blood flow to your heart. So what can you do to help? Well, this is where you have more control than you might think. So stop smoking if you can. That is one of the best gifts you can give your heart. Move your body most days. Even gentle walking helps. Eat more plants and fish, less salt and processed foods, and keep an eye on your blood pressure, your cholesterol, and your blood sugar. So I know these aren't quick fixes, but over time, they really help protect your heart. Treatments that help. If you are diagnosed with angina, you're not on your own. We have great treatments available. So I've already mentioned the GTN spray, or these can be tablets to use when the pain comes on, and they work fast. But you also should be thinking about things like statins to lower your cholesterol, aspirin or similar medicines to prevent clots, and beta blockers to help the heart cope. Sometimes we use extra medicines or even procedures like stents or bypass surgery if symptoms aren't controlled with tablets. When to worry. Okay, this bit's really important, so pay attention. If your pain lasts longer than 10 minutes, feels different or stronger than usual, or happens when you're resting, then you need to get seen straight away. You might have to think about calling an ambulance. Don't drive yourself. It could be what we call unstable angina or even a heart attack, and you may need urgent help. So life with angina. Now here is some good news, because having angina doesn't mean you need to give up on life. Most people can still be active, have sex, travel, live well. Think of it as your heart giving you a little nudge to take action. It's not the end of the road. So if this video has made you think, that does sound familiar, please don't ignore it. Book an appointment with your doctor. If it's happening right now or lasting more than 10 minutes, then do think about calling an ambulance. If you found this video helpful, give it a thumbs up, share it with someone who needs to hear it, and subscribe for more clear, calm advice. I am Dr Sophie GP, here to help you understand your health and feel more in control. See you next time.